are from, first, Henry Ford Jackson Hospital, Perinatal Bereavement Coordinator, Nurse Joy Sterrett, and from the Jackson County Health Department, Fetal Infant Mortality Public Health Nurse, Cindy Wolfinger. Welcome back to the show.
Thank you.
Thank
Thank
you
you for having us.
So you guys collaborate, you team up, work together, not just to be on the show today, but that's something you do all the time.
Yes, correct.
Had quite a few discussions over the years about our statistics with regard to infant mortality, of infant and maternal health. For years, not so great. Are we seeing any improvements in the community?
We are. We're seeing a slight improvement. Our 2022 data is still in a preliminary out there in the state of Michigan, but our preliminary rates do look like it has dropped. Our 2021 data that we do have, it was still pretty staggering. We had 17 infant deaths, 10 stillborns in our community. We had 244 miscarriages, known miscarriages that come through the hospital. So we still had a very high incidence of fetal and infant death.
Wow, those are alarming.
Yes.
And there could be more miscarriages that just don't happen through the hospital.
Right, correct.
I mean, do we know why? When you look at the causes of death, or why this is happening?
You can speak to
We don't have a specific reason by any means, but it is part of what my program is not so much necessarily for the miscarriages yet. Maybe one day we'll look at those a little bit more, but for all of our fetal and infant deaths, that is my job of looking at all the records we can possibly find related to those deaths. Hopefully the family members as well will participate in an interview with me to share their side of the story. And I take all that information, I de-identify it and present it to a team of professionals in the community. And we kind of look at that together of what could we have as a community could have done better. Not to place blame by any means, we're just looking at what can we maybe implement to hopefully prevent future deaths and help more babies reach their first birthday. So it's, not one big thing that we can say is causing these deaths, but lots of little things for sure.
Yeah, so what a horrible tragedy for a family to deal with. And you mentioned blame, because we've talked, Joy, about families, the moms, the dads, they take on responsibility, which is not something that should happen.
Right. We don't ever want to come across as being judgmental when they've had a loss. We just want to be there to support them in their grief and provide resources to them.
Yeah, there's things like SIDS. It's no one's fault.
Right. Exactly.
Right.
So how we prevent is one part of it, but how we care for families is the other part of it. And that's so 17 times this past year you've had to work with a family that had a loss.
Correct. Yeah,
Plus,
in 2021.
Yeah.
Yes.
So you love your work.
I do.
Yeah.
I do. I wish that I didn't have a need for my position, but I feel very blessed to be able to provide the resources for my families.
All right, so there's a whole program, and the Benjamin recently provided you with a grant. Tell me about that.
Yeah, they provided a large donation check for our perinatal bereavement coordinator at the hospital, or in the program. It was over $7,500, and they're such a dynamic group of men who are really there to promote, health and well-being in our community by trying to fund some of these nonprofit and charitable organizations.
And right now, the Benjamin is currently reviewing the current quarter applications. So it'd be a great time to, as a man, join the Benjamin, and you can do it online. You don't even have to go to a meeting. All you have to do is just donate, and your help would be appreciated. They've got, every quarter they've got 3 or 4 great organizations all making a pitch.
Yes, yeah.
So
and I was lucky enough to be one of those that were able to be a recipient of their funding.
That's good. And you've got a grant too.
Yes, so together we actually were recipients of a grant through the state of Michigan for this next fiscal year that'll allow us to further branch out and expand our bereavement programs and resources here in Jackson County.
Tell us about what you guys offer in terms of the bereavement program to a family that has a loss.
So we offer really quite extensive resources. We're offering to help fund, number one, for cremation or casket fees, which has been a new initiative since 2018. And then together we co-lead a support group for a community. Moms and dads, grandparents can even join for anyone who's had a miscarriage or an infant death. And we provide so many other resources, including books and items for children of the siblings who've had a loss, grandparents of the child who's deceased. And so we have a lot of different resources, and then including miscarriage resources that we provide to the ED, surgery center, surgery, doctor's offices.
You brought in some of the items that you assist families with.
Yes. Yeah, with one of them, so we are very pleased to announce that our mausoleum, that was also funded by some of our wonderful donors in our community, is nearing completion. So with that, we have volunteers that hand make the caskets because they have to be a specific size. And so this is an example of one of our little preemie caskets. This would be for under 20-week loss, so a miscarriage. And it's such a good example to show that regardless of the gestational age, we are providing resources and burial resources for even our miscarriage moms. And this is, as you can see, it's almost like the size of a cell phone. Very small, but they make them in all different sizes.
And then the family can choose to have a burial wherever they want?
Correct. Yeah, they can have a burial wherever they want if they so choose. Then we would just pay for a regular casket cost, or we can pay for the cremation if they choose that as well.
And you're building a mausoleum?
Yes.
At the hospital?
No, it's at Roseland Cemetery,
Okay.
Roseland Memorial Garden. Yeah, it's actually constructed. We're just finishing some of the foundation work of it around it.
And this, so it has to be a certain size because there are space?
There is, but we can fit full-term infants up to age 1.
One of the things you've mentioned before, giving moms to be the resources ahead of time before the baby's born, or as soon as they learn they're pregnant. Are we able to get people to doctors while baby visits? Do we have enough clinicians in the community now so that everyone can get that care?
That has definitely been an issue in our community because we've had so many retire and some that have left our health system. We have hired some more OB-GYNs, and our health system is definitely trying to do what they can to ensure that each patient can get seen in a fair amount of time. But it's definitely been a challenge recently, but we're working on it.
Yeah, I remember when our kids were born, we had difficulty finding an OB-GYN, and this was 35, 40 years ago, and it's been up and down, and every community has these kinds of issues. And I think healthcare shortage in general is affecting every area,
Yes.
every service area.
Yeah, definitely.
And is it just, Cindy, Jackson County, are we an island of bad statistic, or is it other parts of Michigan?
Other parts of Michigan are struggling. Unfortunately, we are the worst in our immediate area. But like Joy was saying, our preliminary numbers, they do look a lot better for last year. So hopefully when those numbers are finalized by the state, which should be in November-ish, hopefully we'll find that we are correct and they are improving and we're on the right track with getting more education out there, getting more initiatives out there.
Well, the fact that we're talking about it and there's forums that is being addressed, that's a big first step.
Correct.
I was talking with my wife earlier today, and she reminded me she had a close friend many, many years ago, like 30 years ago who lost a miscarriage, twins.
Oh.
And she remembered how important the very special package that you provided the parents, how comforting it was, and that they ended up having something to hold on to after the tragedy. And that's a big part of when they leave.
It is. It is. We don't want them leaving with, aching arms, empty arms. We know that the items that we are providing aren't going to replace their baby, but hopefully it will provide some comfort for them in a very hard time in their life.
Who does this? Just you? Do you have a team?
So I do have a committee of nurses that help me also at the hospital. And then it's been such a huge, huge help for Cindy to come alongside me and even help with our support groups. And, we're offering now to do some in-person meetings with patients. And, it's going to be a really great thing to collaborate now with, Cindy and the health department.
Yeah, having that support.
Yes.
And as a person, having to face these folks with the tragedies, it's got to be difficult. Just from your standpoint, Cindy, it's got to be emotionally draining.
It's hard. You're meeting these people on the worst days of their lives, and their lives will never be the same. So it is nice to have that collaboration with Joy, though, because we can provide more extensive referrals and help for these families, and then also just as a support for each other with what we emotionally go through as well.
Yes,
Very good.
definitely.
You brought a couple of other things you wanted to show.
Yeah, we do have other volunteers who are still making these lovely little blankets, and if you can again see how small that we have our sizes range, and then we still do have lovely gowns that our volunteers have made in the past. We do have one volunteer still making these particular items, but we are in need of more seamstresses, so if anyone's available. I have tons of wedding gowns. We're not accepting any more wedding gowns because we have a whole storage unit full.
Okay.
But now I just need the talent.
Great. Just contact Joy at the
Yes.
hospital, and she'd love to hear from you.
Yes.
Thanks for being here.
Thank you so much for having us.
Perinatal Bereavement Coordinator at Henry Ford Jackson Hospital, Joy Sterrett, and from the Jackson County Health Department, Fetal Infant Mortality Public Health Nurse, Cindy Wolfinger.